Welcome, everyone. It's so good to see some familiar people that we have relationships with and some new people. So I'm Marie Abraham. I'm the Vice President for Programming and Publications at the Institute for Patient and Family-Centered Care. And today, this is kind of a follow-up to our last June informal conversation because we didn't have enough time to get through to everything. So we are joined by an expert team from the Ontario Caregiver Organization's Essential Care Partner Support Hub team. So we have Lisa Raffoul, who you may remember her from the June informal conversation. She is implementation lead. We have Allison Kilborn, who is the manager at the Essential Care Partner Support Hub. We have Melissa Nagao. She is the implementation lead. We have Aliyah Poda, who's also an implementation lead. Sarah Tariq, who's also an implementation lead. And then we also have Fardosa Halain, who is the knowledge exchange lead. So it's wonderful to see this great team here. As I said before, feel free to chat in your name, your organization, where you're located. That would be great. We'd love to see that. And we are recording this conversation so we can share it with others who registered just for the recording, and we'll post it to our website. We love seeing faces. So if possible, keep your camera on, but if you want to go off camera when the presentation starts, that's fine. You can go off camera. Love to see your faces during the Q&A though. Next slide. So we want to acknowledge our PFCC Connect sponsors. We have Emory Healthcare. Thank you so much. And University Health. They support PFCC Connect, and without that support, we couldn't continue these informative and inspirational conversations. Next slide, Matt. So we want to make sure that we all are kind of in agreement. As you know, our conversations are intended to be interactive and informative, and the presenters will be sharing slides to set the context and provide information to get the conversation started. But then we'll dive into the Q&A portion. And we just want to remind everyone of our group agreements. Be as present as possible. When we move into discussion, it would be great if you could go on video. Participate actively. We encourage you to be curious and ask questions, contribute your experiences, perspectives, and challenges, any that you've faced. You can either chat in your questions or ideas or raise your hand and we will definitely call on you. Let's share space, so allow others to contribute to the conversation. Embrace a learning and growth mindset. All of you bring expertise. It's not just us, it's everybody here in this conversations, and we have a lot to learn from each other. And then finally, we hope you enjoy the discussion and have fun. If you do have any technical issues, you can chat directly to Matt DeSilva. Next slide. So thanks to all of you who shared questions and comments when you registered. Here are some of the issues that we learned about, and I don't want to spend too much time on this because these are going to hopefully be addressed in the presentation and also in the Q&A. So getting staff and leader buy-in, training offered to families so they can participate in safety rounding and other types of meetings, recognizing family care partners as team members, sustainment after implementation, and then addressing challenges. So as I said, I'm hoping that we will get to many of these issues today. And I'm turning it over to, am I turning it over to Lisa or Allison?
I'll start us off, Marie.
Okay, perfect. Thank you.
Thanks so much. And if we can go to the next slide, I'll start us off. Really, really amazing to be here with all of you. I see lots of our neighbors and partners from Ontario introducing themselves. So, special hello to folks who are near from us, but also really thankful to be with you all over kind of North America and beyond. Uh, we are really excited for this conversation today and really look forward to the discussion. I will start off by telling you a bit about our organization and our team. And then we'll kind of talk about the why, and we'll move into other elements, and we'll do a bit of a shared presentation across the team. So, the Ontario Caregiver Organization is a nonprofit charitable organization in Ontario, Canada. Our organization exists to improve the lives of Ontario caregivers. As part of our organization, we provide free programs and services to caregivers. These include things like self serve online resources, as well as a 24/7 helpline. We also gather insights from caregivers in Ontario and engage them in program development and design, as well as offering insights to government and decision makers. Our work also at OCO is with health system partners and healthcare organizations to really integrate caregivers across the healthcare system. And this is part of the work we do at the Essential Care Partner Support Hub. Shout out to Marie for getting that mouthful right so many times. So thank you for that. Next slide, please. So, our Essential Care Partner Support Hub at the Ontario Caregiver Organization is part of our Strategic Partnerships and Innovation branch at OCO. And very simply put, we help healthcare organizations to build and strengthen a culture of caregiver inclusion. And I say culture here because we really want caregiver inclusion to infuse every policy, practice, and process across entire healthcare organizations, much in the same way that we think about people-centered care. The Support Hub acts as a resource center and knowledge exchange hub, which includes staff like our implementation leads who are here on the call, who are in roles where they're providing direct guidance and support to healthcare organizations, really with an eye to spread and scale caregiver inclusive programs and practices, which we call essential care partner programs and practices across our health system. We work with healthcare settings within specific target sectors. These include hospitals, long-term care homes, home care providers, primary care teams. We're branching into community support organizations. We also work with Ontario health teams, which in an Ontario context are organizations that organize and deliver services in local communities by bringing together healthcare providers from across health and community sectors to work as a collaborative team to better coordinate care and share resources. That's a little bit about what we do, and I'm going to spend the next few minutes unpacking why we do it. So if you could please go to the next slide. Caregivers play a critical role in patient health. I think we all know this, but they provide, physical, emotional support, which looks different depending on each care recipient and care partner relationship. And I think probably many of us who may be patients or caregivers ourselves can understand what this looks like within our own families and relationships. Caregivers become essential care partners when they're designated by the care recipient and formally recognized by a healthcare setting. So essential care partners could be family, friends, or other caregivers identified by the person or their substitute decision maker if they're not able to make that decision. Really, though, essential care partners are the people who are consistently involved in the person's healthcare journey, and they provide support according to the person's needs, but also according to the caregiver's own ability and capacity to do so. Ultimately, caregivers are the thread that connects all aspects of patient care, providing incredibly valuable knowledge that's crucial for keeping care recipients healthy and safe, while also providing while also helping providers in their role. If you can go to the next slide, please. When we think about what this looks like, I want us to think down to some of the nitty gritty. So really understanding that caregivers bring immense value and dramatically improve care. So they They improve trust, collaboration, and communication between healthcare providers and care recipients. This we see this on a daily basis. Caregivers are often supporting translation needs or communication challenges for their care recipient. Simple things like taking notes when things are overwhelming or hard to understand. Caregivers can ask questions that can help bring clarity and speak up when a patient may not feel comfortable or able to do so. Caregivers, of course, bring a continuity of care over time across multiple care settings. They are often the holder of the care recipient's story and are able to share important information about past events and decisions and support integrated care across settings and during transition points in the system. They're often the ones responsible for implementing the care plans, and they provide medical information that can be as important or dependable as the medical record. Through their vigilance and knowledge of the care recipient, they often know them best. They prevent medical errors and insufficiencies that may exist in our system. These roles are even more important when we look at the changing demographics in our near future. So, in Ontario, over the next 20 years, we expect our population to grow, and with the most significant increase, of course, being in older adults. And in parallel, millions more Ontarians are projected to be living with chronic illnesses. We estimate that this means that the number of caregivers in Ontario will more than double in the next 5 years. And this will place extraordinary pressure not only on the health system, but on family caregivers themselves. So we really want them to be ready to engage in those roles in the most successful way they can with healthcare providers. I'm going to pass the baton now to my colleague Lisa. Marie mentioned that you may remember Lisa from the last informal conversation in early summer. And Lisa will talk a bit more about the why and introduce some key strategies for healthcare organizations to think about.
So much, Allison. Matt, if you could go to the next slide, please. Building on what Allison has just said, all of this translates to very real outcomes for care recipients and, in turn, of course, positive outcomes for the healthcare system. Research and evidence shows that caregiver involvement can lower readmission rates back to hospital, reduce falls and falls-related injuries, can reduce psychological comorbidities, and can decrease length of stay in the intensive care unit. Research and evidence also says that caregiver involvement can improve medication adherence. There's an increased understanding of discharge information. If caregivers, of course, are involved in those discharge conversations, there's sustained cognitive function for older adults and can find that there's earlier detection and treatment for cognitive changes. Next slide, please. So as we've illustrated, caregivers play an invaluable role in our healthcare system and communities. They provide an estimated 3/4 of care in Ontario. They also offer unique knowledge, as Allison had mentioned, that can enhance care delivery and health outcomes. While caregiver inclusion is no doubt improved from pandemic levels, caregivers are unfortunately still excluded from care or under-recognized in spite of their immense value. OCO conducted research among Ontario caregivers, care recipients, and healthcare providers across care settings in 2023. What we discovered was that caregivers' perceptions about their inclusion are highly influenced by individual interactions with healthcare providers, and experiences are mixed. On the whole, the majority of caregivers still feel that they are excluded from care, that they are not fully incorporated as members of the care team. Despite their responsibilities for managing care, caregivers report being seldom asked what they need in order to continue providing care. Also, healthcare providers don't all feel the same way about including caregivers, as you might expect. Some healthcare providers report that the contributions of caregivers are sometimes viewed as an annoyance. The most mutual benefit reported by caregivers and healthcare providers in care settings with the most continuity and opportunity for relationship development over time. In other settings where we don't see such success, inclusion is not consistent. Healthcare providers can make a meaningful difference to the caregiver experience and the quality of healthcare. Our work, illustrated in this slide, centers on three important strategies: recognizing and identifying caregivers in their important role, including caregivers as true partners on the patient or resident or client, depending on the audience, on their care team so that they feel empowered and welcome to participate in care, and connecting caregivers to support for their own mental health and well-being so that they are at less risk of burnout and can continue doing the important caring and support. I'll now pass it over to my colleagues Aaliyah and Sarah, who will talk a bit more about some of the practices under these strategies. Aaliyah, over to you.
Thank you, Lisa. Next slide, please. Thanks. So under Identify the Caregiver, one of the key practices is to use some form of caregiver identification to identify and also formally recognize essential care partners and the valuable role that they play in care. Care recipients are encouraged to designate their essential care partner, and these individuals are then documented in patient files appropriately. There's also an opportunity here to increase caregiver self-identification. The more that we empower caregivers to self-identify and support caregiver recognition, the more that we can prevent caregiver burnout and move to improve patient and provider experience. If caregivers are identified, especially early, it supports opportunities for ongoing connection and support. Next slide, please. Thank you. There's an opportunity to involve and include caregivers at all points of care. So intake, assessment, care planning, touch base points, and especially at discharge and transition points, so that caregivers are well equipped and positioned to support the person that they're caring for. Including caregivers improves transitions across care settings and helps reduce readmission to hospital, increases care plan adherence, and improves overall patient outcomes. Education for staff across your setting on the important role of caregivers and practical strategies is key to ensuring caregivers are identified, included, and supported across an organization and throughout a patient's care journey. Engaging staff in the design of your work and obtaining their perspective can increase the likelihood of follow-through. Having conversations during huddles or creating an information board on the unit are also good strategies to ensure that staff are enabling caregivers to participate as true partners in care. I'm going to pass it over to Sarah now.
Thanks, Aaliyah. Next slide, please. So on top of identification and inclusion of caregivers, connecting them to support is crucial to their well-being and avoiding burnout and ensuring that the caregivers can continue in their caregiving role. Many find it hard to ask for help and feel they should be able to manage on their own, but caregivers who don't seek or accept support may have a higher risk of burnout. Here, healthcare organizations can proactively address caregiver supports by connecting caregivers to resources that support their own well-being, providing education and information that empowers them to participate in care, and orienting or onboarding caregivers to the organization so that they better understand the care setting. Next slide, please. The Essential Care Partner Support Hub works with healthcare organizations in Ontario, Canada, and it exists to guide and support healthcare organizations as they adopt caregiver inclusive practices, providing free resources, tools, and templates, leading practices based on what has worked with other organizations, opportunities to connect, learn, and exchange knowledge with system leaders, providers, caregivers, and peers. Implementation leads like myself provide ongoing guidance and coaching to healthcare organizations to implement essential caregiver leading practices and programs within their organization. As Allison mentioned earlier, we work with hospitals, long-term care homes, home care providers, and primary care organizations. I'm going to pass it off to my colleague, Melissa.
Next slide, please, Matt. The Essential Care Partner Support Hub offers many tools and templates that our partners can take advantage of. And some of the more popular resources that we share include our templates for caregiver ID. So that's in the top right-hand corner. These are already created badge templates for helping to identify caregivers in a healthcare space. Our Taking Care of Someone infographic, which is on the very left, We find that sometimes family, friends, or neighbors don't identify themselves as caregivers, and this infographic helps to provide that language to someone in a healthcare space. It's also helpful for diverse populations that don't always have a word for the caregiving role that they take on. This infographic helps patient populations and caregivers to see the roles and the duties that someone may take on when they are an essential care partner. Our implementation toolkit. So this is a guide for hospitals that helps them to understand in a step-by-step process how to implement their own essential care partner program. It includes guiding principles, leading practices, and how to prepare, implement, and then also sustain their implementation. And then we also have an evidence summary for hospitals. Sometimes our champions need a business case on why to implement an essential care partner program. This summary includes stats on the benefits to patients, caregivers, and staff when essential care partners are involved. Next slide. Spot. We also have a journey map that shows what a good pathway looks like for an essential care partner as they pass through the healthcare space with the person that they're caring for. This falls under our 3 pillars of identify, include, and support. We've shown a brief outline of the journey map here on the slide for the purposes of this presentation, but it's actually much more detailed than this. It includes points where essential care partners may be included in the EMR, when they may get training or an orientation, how the ECP is worked into workflows for staff, and resources that essential care partners can be given along the way. Healthcare staff are able to see where their roles lie in the journey map that we've created. And now I'll pass it over to Fardosa.
Thank you, Melissa. Next slide, please. So when we think about supporting patients, we can't forget about the caregivers who are right there beside them. We often hear here at OCO, caregivers often feel invisible in the system. But making small changes in how we interact with them can make a big difference. I have this resource here that we have developed to help point of care providers different ways they can support caregivers. So you can see there's 6 easy ways that they can support. It can be as simple as checking in how they're doing, keeping them informed about what's happening, and as well as encouraging them to lean on available resources. And so caregivers sometimes feel hesitant to ask for help, and so just opening up the door can make a difference. We do have this resource available on our website, and we will share it after as well. Next slide, please. Here I have a slide on our Learning Collaborative. This is something that I lead with the team here at the Support Hub. Learning and sharing with your peers is helpful. Sharing what has worked well and strategies to overcome challenges is also very helpful to learn from others. So our Essential Care Partner Learning Collaborative has emerged as a hub of cross-sector learning. And the Learning Collaborative essentially is a forum for healthcare organizations like yourselves that are committed to enhancing caregiver inclusions. We meet virtually every 6 weeks or so to share knowledge, challenges, and solutions, as well as tools with a focus on 3 key areas. The first one is building a culture that values and recognizing caregivers as partners on the care team. Second is formally identifying caregivers using tools such as caregiver identification badges, as well as the last one, which is ensuring caregivers are connected to support. This is the QR code, which you can register for the Learning Collaborative, but we'll also send the link after as well. And now I'll pass it back to Allison, who will close us off.
Thanks so much. I'm so excited by all the chat already. Emily, your questions in particular, I hope I can even address in some of this next slide, please, if you can go there. So, as we have worked and collaborated with healthcare organizations across Ontario and with health system partners and providers doing this work, we have gained a better understanding of some of the overarching core elements that help build a culture of caregiver inclusion within and across settings. These 6 core elements that I'm introducing here are really part of our understanding how to successfully embed caregiver inclusion as an expectation and part of the culture of care. Certainly, and this kind of gets to Emily, one of your questions in the chat, commitment from leadership and a plan for sustainability, including early evaluation considerations, are significant facilitators in moving this work forward. This might include, leadership both establishing and communicating a vision and messaging for caregiver inclusion, a commitment to engage caregivers in the design and development of any practices or programs from day one, and dedicating resources, including a program lead, for instance, to any kind of caregiver inclusion project or implementation. Some of the practices and programs under each of these core elements are really aligned with people-centered care and support a kind of move towards more relational care as opposed to transactional care. Ultimately, we're envisioning a health system where caregivers are valued and recognized for the knowledge that they have, their role, and welcomed into healthcare settings and organizations, empowered to participate as partners in care, and then really connected to support for their own well-being so they can continue caring. I have a yearning to get right to the discussion, so I'll go to the next slide. And just thank you everyone so much for already some of the questions and comments that have come in, and really look forward to the conversation. Thanks again on behalf of our whole team for having us here today.
Thanks. What a great team. You guys did a fabulous job. Bud, I see your hand is raised.
Everybody hear me?
Yep.
Okay. And if I'm way off base here, please let me know. My caregiver situation may be a little different here because I dealt with children with cancer. Okay. My daughter had cancer, went through 10 years of treatment, had a malignant brain tumor, and passed away of ovarian cancer at the age of 13, and her brain tumor was at 18 months. What I see though is, and like I said, if I'm out of line, let me know. I was at the Medical College of Georgia, which was a teaching school pretty much back then. And, we had doctors who would come around at 6 o'clock in the morning with students and, and waking the kids up and all kind of stuff. I don't know how in detail the caregivers get, but do any of the caregivers have a family patient-centered care council of their own with maybe direction from people like y'all, like we had? Like I was the only one at our organization that didn't work there. And I see this a lot on patient family care across the nation. I see where a lot of the groups are made up with just maybe physicians, nurses. We had patients, we had physicians, we had everybody, the whole gamut of everybody on our team, and then me. I was the only one that wasn't paid, hired, or worked there. And the benefit was that, for example, there's different walls in healthcare. There's a lot of times there's a wall between the physicians and the nurses, right? Which the nurses pretty much know a lot more than the doctors a lot of times, but they're just afraid to speak up. So I was kind of like that conduit for 15 years because they would come to me and ask me their questions, and then I would ask them because they can't fire me, because I didn't work there. But I wasn't afraid to ask the tough questions. So we could bring in, like, I could have some doctors come in and say, hey, this is going on. What can we do about this? Or I could have environmental services come in and say, hey, do we really need to be cleaning rooms at 12 o'clock at night when these children are trying to sleep? Or ask the physicians, do we really need you waking these kids up at 6 in the morning? They need their rest. Their bodies need rest, just like everybody else. And then we would work through those things together. So when you're speaking of caregivers here, it sounds to me like you're talking about maybe once they get home. I don't know, but I'm just wondering, if the caregivers had a group like this. I don't know if they do or not, but it would seem to me that would really help to bring it more together, to get all the groups together. And maybe, I don't know. That's just me thinking out loud, but because I've been doing this for a long time, and I've seen a lot of things happen when they're not brought together, like, like med students giving the wrong prescriptions. The patients and the caregivers, if the caregivers, especially parents, they need to be involved in everything. And it's just, but a lot of them are afraid to speak up. They don't want to offend the physician. They don't want to, I don't know. I'm kind of rambling now, but what are your thoughts on that? Anyone?
Does anyone want to speak to that? I mean, for me, I think that's an issue of culture in the environment of the hospital. And we've worked with that, like doing, partnerships that will help people. Like, you don't have to be afraid of speaking up. So, but I'm happy to pass it off to anybody on the team here.
Maybe I'll just jump in and encourage anyone else from my team to answer. I think that what we, certainly in Ontario, lots of most healthcare organizations, certainly hospitals, have patient family advisory groups or committees, like all of that are deeply engaged in improvement work at the organization. But I think that when we're trying to think about the work we do with organizations, is really thinking about those point of care interactions. So enabling those partnerships to happen at the individual kind of patient family level, that can be really strongly led by those family voices within care organizations. And we've certainly seen that being a huge driver of success in terms of changing the culture of those organizations, when families and caregivers are leading voices in organizational change.
Mm-hmm.
Lisa, do you want to jump in there?
Yeah, thanks, Allison. Again, I'm following you, so building on what you just said. Bud, sorry to hear about your daughter, and thanks for sharing your story with us. That's why we're doing the work that we're doing, really, is you're not alone. Many people are afraid to speak up. They're, fear of repercussions, or at the risk of the relationship going south, so to speak. But that's why we're doing what we do, is to help healthcare providers, and many understand the value of including caregivers. Many really do. Some people are doing it and they don't even realize the good work that they're doing. But really, to create that consistent experience for people, that consistent positive experience, so that people do understand. And as Allison mentioned, and others have mentioned, building this into the culture of the organization. Caregivers provide a wealth of assistance, really not only for the care recipient, but for healthcare providers. And that's part of the success, is really communicating and demonstrating the why and the benefit. I'll stop talking and let others share their thoughts.
I can quickly jump in, and I just want to say to Bud, thank you so much for sharing your story and for asking that question. It's a really important one, especially, as Lisa said, when it comes to advocating for, better patient health. And I think, as we're all speaking to the culture change work, I know that there are so many organizations who have, literally spent years and years building that culture of, like, being open and honest with the care providers that are in the hospital. I know that there are hospitals in Ontario who they have their patient and family advisory, but leadership is always involved and always attends every single meeting that the Patient and Family Advisory Council has. And not only leadership, but sometimes like a rotation of staff. And that took a lot of hard work to get, all of those people into the same room. But once, you're involving multiple different people in the organization and start to do that change work, And often I find that caregivers are caregivers are the biggest champions, you know, of this work and of making sure that like patient health is taken care of. And so, you know, finding the champions that are not only caregivers but who are also staff, I find is really helpful to kind of building that culture.
Thanks, Melissa. Karen, you had your hand up for a long time, so you want to go ahead?
Thank you. So I'm a member of the PFAC at Children's National in DC. And our PFAC does have caregivers, family members, patients, and staff, and including leadership. So I agree that that's really powerful. Two of the things that we have done that helps spread that culture that you're talking about, one that's been going on for about 4 years, is we actually give grand rounds twice a year. So these are designed by us, directed by us. The rounds can be, we've done some that have included patients or family members and some that include staff to talk about how to do some of these practices. And though that's training for the staff, that's medical education. So it really embeds the idea of what the practices are, but also the value of family members as a partner in the care team. You know, when you have that kind of status of we're going to give grand rounds, it's not just a patient journey story and a heroic parent. This is, there's things to learn from this that's really valuable. We've also been part of research projects that are about teaching family-centered, patient and family-centered rounds at the hospital, where you're interacting with the attendings and the residents as they round and giving them feedback about what they can be doing differently. But the other side of this, and those are all great and they're valuable and we've made tremendous strides, but the side of it that I'm not hearing as much, these are about how you teach the staff about what they're supposed to be doing. There also needs to be teaching for the family members about what they can be doing, what they're allowed to do. You are allowed to put a sign, I did it for my son, on his door that says, go see the nurse before you walk in this room, because I don't want anybody coming to clean at 6 o'clock in the morning when he hasn't slept. So, but family members don't know that they're allowed to do that. So somehow family members need to know you're allowed to say no to things. You're allowed to ask more questions. You're allowed to call a code if you feel like your kid is in danger and you don't think that people are hearing you correctly. But they don't know that because they're coming in under crisis and they're coming in hoping for the authority and to be taken care of by all those authority figures. That's the other side that I would love for this group to address, is how do you teach folks who are in it how to take advantage of what they're needing to do.
Thank you, Karen. I think that there are a lot of great resources in the hub that this team is from, and both in educating staff, but also educating care partners. And then we have at IPFCC, we have the Better Together toolkit, which has the same thing. They have materials for staff and materials in education for families. So, yeah. Okay. We have a lot of hands up. So, Emily.
Thank you for this. It's really inspiring. One of the fears that I have around institutional change is, okay, we implement the change. This is the way we want to do things. And somebody makes a mistake. Let's say a nurse points out a doctor has made a mistake and the doctor reacts to her angrily, like his ego has been hurt. How do you treat that doctor when they get called in? Do you wave your finger at them and yell at them, or you engage in a real conversation with them? And that, I mean, that to me, that kind of a change where we all react that way. What you did scared me. Well, how do I react? From the patients, the caregivers, the nurses, the doctors. It seems to me that's the biggest challenge. No, what's your thoughts about that?
Who would like to tackle that?
I'll jump in and just tackle it quickly. Emily, you've kind of given that scenario really well. I don't think that there's there's no perfect recipe for it, but I would go like education and kind of is one of those key pieces that for staff, including physicians, that kind of thing started. We're at OCO, we're looking at like, how do we look at broader provider education right from when people are, in school before they get into the workforce. And I think that that's part of it, is like understanding perspectives, but that's where we can't just count on, I think, individuals to always kind of be their best in that scenario. So faulting the kind of education, doing all those things, we're looking at those other structural opportunities that give the chance of partnership the best success in order to be able to handle that moment when that happens.
Yeah, I thank you. And so one of my concerns is, where's the money and the institutional support for doing that kind of training and ongoing conversation about what do you do when you're human and you make a mistake, right? How to react. To me, we don't have enough support in the institutions, in the larger institutions, the basic funding of healthcare that says we're going to fund that. And that's one of my big fears. Thanks.
Yep. Eileen, you have your hand up.
Hi, thank you very much. I'm president and founder of Pulse Center for Patient Safety, Education, and Advocacy. We're going into our 30th year of educating the public on patient safety. And Karen Anthony kind of hit it on the head there for me on what the public doesn't know. Our focus for 30 years has been to educate the public that how they could become patient safety advocates for their loved ones. I've been a caregiver now for almost 3 years for a family member. That was unexpected. I love it, and I'm learning a whole new world of caregiving and what I've been teaching. But also, I want to know, why are we spending so much time focusing on the healthcare institutions and healthcare providers when their conferences and their studies and research go to them? It's not getting to the public. And why aren't we focusing more on public campaigns with cancer groups, with rare diseases, with young mothers, or groups of people who use the healthcare system, and teach them their rights, what they need to know, and how to avoid medical injury?
Great points, Eileen. I don't know if you know the Betsy Lehman Center for Safety.
Absolutely.
Yeah. And so I think they do the same thing. They're committed to that those same issues that you were just speaking about. But anybody else want to jump in and respond to Eileen?
Would like to, if possible.
Sure.
The last question, I think, to answer that, you really have to have 100% support from the administration side, especially when you're dealing with doctors, and like we bring them in and we have discussions with them. So somebody had made the comment about how many people are involved in the whole process, and that's really what you have to do, is you have to have, everybody involved, and those situations then become a lot easier to take care of. As far as this question, I think that's where you have everybody involved, from patients to physicians to environmental services to outside organizations that can come into your meetings and things and discuss that. And then, of course, hospitals do have their people that put out press releases and things like that. You can set up different days where you talk about these kind of things, different events we used to do for things like that. That's just a couple things you could probably do, I guess.
Okay. Thanks, Bud. Marion.
Hi, thank you so much. I'm Marion Moore. I work with Common Spirit and we have a number of hospitals, but the focus has really been in response to how do we have greater impact and voice moving beyond even the patient and family councils to patient and family partners, where they're sitting beside the people that are making the policies and positions, and the improvement teams, the quality, safety, grievance committees, patient experience resources and all that, where they're developing that, is making a difference. And then at the bedside and in the nursing education and so forth, really building in patients is just part of that, and breaking down the idea that it's novel for a patient to be participating in anything that we're doing. That's the difference. Patients are not visitors in our work. Patients are not visitors in the rooms with their family members, but they have a voice. And creating that culture is taking time, but it's definitely taking off, because when the patient speaks, they don't really listen to the leadership at the teams necessarily, but when the patient speaks, it changes the dynamics. And when they're sitting in the meeting, they have the glossary of terms, they know what's expected when you're talking about your metrics, and when you're talking about improvement processes, diversity, equity, inclusion, all of that, it really empowers them to be a part of the team. And that's what's, I think, the next steps, and being on our experience councils for the system, actually having them on the governance, the board and so forth. That's changing how things are done for those providers, those nurses, those billing teams that are actually practicing. It embeds it in the education and actual day-to-day things that are happening at the bedside. So that's kind of like the progress that's moving forward, but it's just moving it beyond, it's just sitting in a classroom talking with the council. They do great things, but how do we empower them beyond that to really work together and be equal at the table? Thank you.
Yeah, and I think having education and support, like having, if you're sitting on a committee, it's great to have somebody who's a mentor and can help you kind of navigate through that before your first meeting with them. So thank you, Marion. Anjali?
Hello. Thank you for having this discussion. It is so interesting and I'm learning so much. I do echo a lot of what has already been said. I think to the point of Emily's question about culture, we are still, of course, working on that. But it reminds me of, I'm taking a fellowship program right now, and it's with quality and safety. And this was just yesterday, we had a discussion about from IHI. There's some really great modules on responding to adverse events and how do we do that and include our families in that. And obviously we want to be preventative first, but that's part of this discussion to me too, how transparent we are, and that whole conversation. And also I think improving the culture to me also means, what are our leadership, our quality safety professionals doing to address the systems? Because we know that, right, like safer systems, like whatever we can do to make fix problems while they're small before it gets to something bigger, so that we don't know that example that he gave with the nurse and the physician, like what was the environment like, what did that nurse have, like 10 other patients? It's just, I think the more we can do around building safer systems.
Thanks, Anjali. Lisa, do you want to respond to that, or?
Yeah, I just a couple of things. Marion, thank you so much for your comment about caregivers. Essential caregivers are different from visitors. That's one of the fundamental principles and practices that we have at the Essential Care Partner Support Hub, and understanding that is fundamental, I think, to moving forward. The other comment about educating caregivers, also very important, and what we've learned from caregivers, they don't necessarily identify as a caregiver. I'm spouse, or I'm daughter, or I'm niece, or I'm good friend. And they're happy to help out. So one of the I think it was a healthcare provider in a hospital a couple of years ago said we need to do a public service announcement or have in the mainstream media commercials that demonstrate to people what it means to be a caregiver and that your role is important and not to be afraid to speak up. But you know, we've at OCO have run campaigns. We've even had posters in Toronto subway, different places to demonstrate and that message. But getting the word out to people, and again, part of the education for staff is to help them facilitate that conversation and help the caregiver understand the value of their role. And I don't know if you saw the chat, but one of the hospitals I've worked with, they have established a meet and greet conversation at the beginning of early in the hospital admission to have that conversation with the person so that, you know, they're welcoming them in. Bud, you're right. There's not a lot of extra funding. So what, you know, usually happens, it's a team effort. In our implementation guides, one of the initial steps to prepare is establishing a working group so that you do get diverse voices in the organization. And then you can also divest and delegate different responsibilities to get things up and running. But you know, there is usually someone or some department that will take the lead and continue the work forward. But you know, for sustainability, those indicators of success, you know, what are we all working towards as healthcare providers, which again becomes part of the culture for you know, what the work that we're doing.
Thank you, Lisa. Jennifer, you've had your hand up for a while too.
When we talk about, I just want to touch on diverse voices or voices being heard of the patient. So we don't just have like a PFAC, a patient family advisory. A member sits on every working group, every committee, every unit council in the entire hospital, as well as we're one of the few in Ontario that ours are actually a voting member on our board of trust. So that means that the patient voice is actually a voting member, which is huge. So that's something that we've kind of trickled down to really let their voice be heard. They sit on interview panels for management level positions, like our patients, families, and caregivers are very heavily involved, and leadership as well. So I just wanted to say that.
Great, thanks. Bart, I think we're going to close this conversation with you.
All right. Thank you. Real quick, I'm really appreciating all of this. And if I go back to a couple of thread lines that I'm picking up, there's some great work. And if I listen to Bud, I listen to Marion, I listen to, you know, a lot of folks. And let me give this context. So I'm Bart Bailey, incoming chair for the Family Advisory Council for Morgan Stanley Children's Hospital, which is under New York Presbyterian in New York City. And so one of the things that's showing up for me is communication, right? And truly being present. So my 6-word story is always be present with my family. I start with that when I'm having a conversation with anybody in the healthcare space. So those 6 words that are similar to Hemingway's "baby shoes for sale, never worn" starts the dialogue. And what I know, I'm 57 years old. Many of us never learned how to have generative dialogue with other human beings, especially now. If you walk in a room and you're sitting there on that cell phone, I'm going to ask you to leave immediately. Right? And so a lot of what I'm hearing is, how do we even have conversation with each other? How do we sit present with each other? So if it's anything around, you know, diversity or patients or nurses or transport or EVS, I have the best conversations. They come in and empty the trash, but they ask you, how are you doing? Do you know where to go eat? Like, you have the real conversation with them. To talk to other human beings when many of us never learned. Like, we're waiting for people to shut up so we can tell you something. Like, can you stop? Because it's my turn. But really the work is, how do we be present and have real, deep, meaningful, I see you, Sarabana, and you see me, we are here together, deep conversations. And so it's a question there somewhere for those that have already presented, how do you get to the deeper conversations? And I'll tell you, I participate in SIMS and helping our healthcare pros to do that, right? So how do we do that?
Yeah, sounds like you're talking about active listening and respectful conversations, and it's great. Thank you. Thank you, Bart, for sharing that. Okay, we are 3 minutes to the end of this great conversation. I don't know, we need to do another one again, maybe. I don't know. Yeah. So, okay, there are a number of sources that were shared today, and the next 4 slides will present them. You'll be getting this slide deck, a PDF. So don't worry about that. You will receive a PDF copy of the slides today from today's session, so you'll be able to access these resources. If you can go to the next slide, Matt, and the next slide, and the next slide. Yes. So go back to the additional resources. So these are great resources from the Essential Care Partner Support Hub. So I would hope that you can kind of follow up on these. Thank you, Bev, for putting that in the chat. Next slide, Matt. So we just put in a few organizations. This is not, there's other great organizations, and I think some of you are on this call today. So next slide. So many of you are members of the PFCC Connect. If you're not, this is a free learning community, so it's wonderful. If you're not a member yet, we encourage you to register so that you can access the great information and resources about patient and family-centered care. You can post questions, you can learn from others, you can share your ideas and resources, and we can continue these conversations. Next slide, Matt. So your feedback is very important to us, and we ask that you complete the survey because we do use the results to give us ideas to improve our conversations and determine future topics. And you can use the link or the QR code to access it. The link has been posted in the chat, I think, or maybe not yet. Let's see, can we? There you go. Thank you, Bev. And then next slide. So our next informal conversation is scheduled for November. We don't have a date yet selected, but the date and topic will be determined. The recording of this conversation, slides, and chat will be posted on the PFCC Connect site. And I think you'll probably be getting the slide PDF after this conversation ends. And then if you have resources, because I know some of you put some resources into the chat, if you have resources that you think would be very beneficial to this conversation, please send it to us so we can share with others on PFCC Connect. If you want, you can send it to me directly, mabraham@ipfcc.org, and then just continue the discussion. And with that, it's 1 o'clock, so it's time to say goodbye. Bye.